Hello, my name is Boyd Tobler and I am a retired dentist. Over the last 30 years, I have taught hundreds of people how to use dental floss and how to brush their teeth to prevent tooth decay and gum disease. This is my daughter Jenny, and we are here today to teach you the 5 steps of daily personal oral hygiene. The first step is to thoroughly wash your hands. The hands touch practically everything, and from a bacterial standpoint, they are filthy. Since you will be putting some of your fingers into your mouth when you floss your teeth, it is very important that your hands are clean. You will need some warm water and some soap, and a little hand brush really helps. You can pause this presentation while you wash your hands. The second step is to brush your teeth and the top of your tongue. Use short strokes up and down, back and forth, and circular. Work the bristles gently under the gum lines and between the teeth. Do not saw back and forth with long strokes along the gum lines. This will cause the gums to pull away from the neck of the teeth. The root surfaces will become exposed and the teeth will wear away at the gum lines and become very sensitive.
There are 3 areas most people miss when brushing: the cheek sides of the upper back teeth, the tongue sides of the lower back teeth, and the corners. A right-handed brusher will generally miss the right corner, and a left-handed brusher will generally miss the left corner. To reach the cheek sides of the upper back teeth, close the jaw about halfway and shift it to the side to be brushed. Good brushing will clean about 70% of the tooth surfaces, so it's best to brush before flossing. Pause the presentation now while you brush.
The third step is to floss your teeth. A toothbrush alone will not thoroughly clean between the teeth. The purpose of dental floss is to clean the tooth surfaces between the teeth and under the gum lines. I would like to show you how that is done. I prefer a dental floss that is lightly waxed. We'll wrap this on the fingers and I'll demonstrate what flossing is supposed to do. Hold it tight, seesaw it so that it passes through the tight spot. You can see how the floss flattens out against the tooth. You put a little pressure against the tooth and scrub it. Let the floss go under the gum line up until there is some resistance. And then seesaw the floss back and forth, scrub it as it's wrapped around that part of the tooth. And then come over to the adjacent tooth and do the same thing over here on this tooth. That's all there is to flossing. Take a piece of dental floss about 20 inches long and wrap one end around your left index finger. Wrap it on top of itself a couple of times to lock it in place. Then leave about 4.5 inches and make one wrap around your right index finger, leaving about 4.5 inches between the hands. It's about the width of one of your fists. Next, extend your left thumb and place the floss over the top of your thumb and then over your right middle finger like this. You should leave about 1/2 inch between the thumb and the finger. You can see that the nails face each other and that the left hand is pushing away and the right hand is pulling towards you. This allows for opposition and it allows you to have some tension and great control as you pass the floss between the teeth. You can see that the floss is going straight away from you at this point, and as you begin to floss, this is the position the floss needs to slide between the 2 upper front teeth. Then as you go around to the left, then the floss turns so that it follows the arch as you go around to the back teeth. This is the way we hold the floss to do the upper left teeth. To floss the upper right teeth, we're going to reverse the hand and floss positions. This time, position the floss over the end of your right thumb and over the end of your left middle finger like this. Now you are ready to floss all of your upper right teeth. Go ahead now and floss your upper right teeth. Next, we will wrap the floss on the fingers to floss the lower teeth. This time, leave about 5.5 inches between the hands. Place the 2 middle fingers under the floss and take your thumbs and press the floss up against the fingers like this. This is the best way to hold the floss to floss all of your lower teeth, both right and left. Take a few minutes now and floss all of your lower teeth.
Let's review the 3 different hand positions for flossing. This is the hand position that you use to floss your upper left teeth. This is the hand position that you use to floss your upper right teeth. And this is the position that you use to floss your bottom teeth, both right and left.
If your teeth and gums are healthy, then once-a-day flossing is considered sufficient to maintain healthy teeth and gums. But if you have gum problems, gum infections, then it is very important that you floss and clean thoroughly after every meal. Actually, you don't really need to floss all of your teeth, just the ones you want to keep. The 4th step is to wash your hands again. When you handle the soiled floss, it leaves lots of bacteria on your hands. Therefore, it is important to re-wash your hands after you have used dental floss. The 5th step is to rinse your mouth. Brushing and flossing loosen lots of bacteria from the teeth that will remain in the mouth if you don't rinse. Therefore, after brushing, take a mouthful of water, swish it around, and spit it out. Now, some people like to take a toothbrush and a mouthful of water after they get all through brushing and flossing and simply go around the teeth lightly once again. As a final rinse, you can make an excellent mouthwash solution by mixing 1 teaspoon of ordinary table salt with 8 ounces or 1 cup of water.
You've heard the saying, an ounce of prevention is worth a pound of cure. The skills we've taught you today will help you prevent serious dental problems.
Dental health is very important. Most of the tooth decay and gum infections that I have seen in my career could have been prevented. A clean tooth will not decay, and gum infections will not begin around a clean tooth. Daily personal oral hygiene is the only way to prevent problems and maintain dental health.
Brushing and flossing are skills that are easy to learn and do. A total cleaning of the mouth, brushing, flossing, and rinsing will take only about 5 minutes once you have mastered the skills. Over a lifetime, you will keep your teeth. You will enjoy pleasant, refreshing breath. You will prevent pain, infection, and suffering. You will save a lot of money and avoid time in the dental office, and you could even add years to your life.